This segment sponsored by Aesthetic Center at Woodhome.
We hear about beauty trends all the time in the media, but are they safe and effective?
Here to dispel myths from a common procedure you may be hearing about is Dr. Theda Kontis. Welcome.
Thank you. Thank you for having me.
We always hear about so many trends, and then there's this stem cell facelift that we've heard about. Tell us more.
Yes. Well, yes, the stem cell facelift is actually a very gimmicky thing that you're hearing about now in social media and in the news. And it's neither a facelift or really stem cells.
Wow.
So a facelift is actually something that tightens the lower face and neck. It's a surgical procedure. A stem cell facelift is what people are calling fat injections to the face.
Oh, no, okay, so you want to add fat? I'm trying to contour my face in every way possible. People actually put fat in their face? Why?
Well, when people are nice and young like you, we have a nice layer of fat under our skin.
Okay.
As we age, that fat atrophies.
Okay.
So we sink in, and then as we get even older, we lose the support and it falls. So as we age, we sink and then sag. So we're finding that if we take fat from the body and place it in the face, we can lift that loss of volume and rejuvenate the face.
Wow.
So,
Go ahead.
I have so many questions. You go.
How much fat do you typically use?
Well, it depends. You can use probably 2 to 3 tablespoons of fat. It's not much. And we just layer it evenly under the skin, almost like making a thicker carpet padding.
Okay, so what's the procedure like? You just do it, it's local anesthesia?
It can be local. What we do is very carefully harvest fat from the thighs or the abdomen, and then we wash it and prepare it. And then we use a small insertion device that's got a blunt tip. It's like a blunt tip needle called a cannula. And we just, under the skin, sort of layer this fat in. Now, the fat does have some stem cells associated with it, and so that's why it's gotten this trendy name of a stem cell facelift. But people have found that actually when you do this to the face, the overlying skin looks better. So they're not sure if it's just because you're re-expanding the envelope or if it's from stem cells, but the skin does get a little healthier.
Does the fat survive, or what happens?
Well, that's a good question. The fat is like an auto transplant, so it has to be small little particles of fat that can get blood supply. So not all of the fat survives. It takes about 3 months for us to tell exactly how much fat's going to take.
Okay, so what's the goal? Is it to get rid of the fine lines and wrinkles? Why do people really come and ask for this?
Well, it's a nice rejuvenating technique. We actually do it in conjunction with facial surgery. So in conjunction with a facelift or lower eyelid surgery, just to restore the lost volume. So it's not in particular a wrinkle treatment, but it's kind of a side effect of the re-expansion of volume.
Where do we learn more information? This is fascinating.
Right.
You can go to our website at www.facial-plasticsurgery.com or call us at 410-486-3400.
All right.
Very good. Thank you for joining us.
Thank you for having me.